Hi, Dr. Garima here, and let's solve another of Australian scenario-based question. Where was I since last 1 week? Sneezing my nose. My son gets cold, I get cold, but thankfully he's fine. But I'm the one who's down with a lot of post-nasal drip. So I got a sore throat, which made me really uncomfortable, and I just could not do anything. But I've been answering all the queries, and nowadays I'm getting queries from students who are enrolled with different mentors, and one of them actually, I don't know how she managed to find my phone number. She actually messaged me saying that I'm confused about the notes that I have from the other academy, and you explained this topic really well. Can I have an explanation for this? She was asking about the ICDA's classification, I guess, but I've already shot that one, so I just told her that. So yeah, apart from solving the candidates' doubts, which as I had earlier mentioned, I almost devote like 1.5 hours because each candidate has a separate doubt, and that is why I do not promote online classes. Because firstly, I'm not teaching you all dentistry, I'm just clearing the concepts. The study part has to be yours because it's you who have to give the exam, and each student may not have the same doubt as the rest of them. So honestly feel online class is a waste of time, because if you are giving lecture to say 100 candidates, uh, all of them will have doubts on different aspects, and it's not possible to cover everybody's doubt, when you're just giving a lecture, because you're just focused on just explaining the topic at hand. So it's always better, I feel, one-to-one conversation where when you ask a doubt, I actually understand how much knowledge you have. Sometimes it even goes down to the level where I ask my candidates to open their textbook and send me a screenshot. And when they do that, they realize, oh, they missed reading these parts, and they automatically solve their doubts. So, and for some candidates, I might leave a voice note ki your understanding is fine, but this is where you are, miscalculating things. So each candidate has a very different level of understanding on the same topic as well. So I need to gauge the depth at which you understand for me to explain you. What is the point? It's not like you're asking me for a direction and I'm telling you go left, go right. You're asking me to understand a concept, because on that concept a lot of questions are asked. So I don't want to give you just a straightforward answer. I want you to understand that concept, and that's why I always feel a one-to-one doubt solving is the best thing to do. So many candidates and emails that I receive, do you conduct online classes? I'm like, no, I'm not teaching you dentistry. This is not a dental school. I'm here to clear your doubts. Study is a self study. You will study by yourself. I'll give you the study materials, I'll give you the past papers, but you have to solve it yourself. So, yeah, that's the mode. So, anyways, I guess 8 days to go for the exam. What you should study in these last 8 days. So one day just before exam, don't study anything. Okay, so technically you have 7 days remaining. Always one day before exam, do not study anything. You will just stress your brain out. A stressed brain cannot perform well. Simple as that. Me, I can never study one day before exam. I start laughing somehow. I'm like, what is this? Tomorrow is exam. Anyways, I'll be like expected to perform in full capacity, and I cannot do that if I exhausted one day before. So I always sit and I watch a movie, or I just chill outside, or I do something which is just not related to studies. Okay, that's my one day before exam. That's my 1 hour before exam. Doing nothing, just relaxing, breathing in oxygen, and just when the exam starts, I'm absolutely fully focused. And this is me not saying just after passing BDS exam. I've cleared my masters, I have cleared my MFDR CSI in first shot, MFDR CPG in first shot, and these two are again two-part exams, part one and part two. And the part two actually had a Viva oral exam, my MFT exam, with four different examiners. So, do you understand the level of concentration it requires? Because when you are actually giving an oral Viva for 30 minutes at a stretch on various different topics, You have to be so conscious of so many things. And all went smooth. I just follow this. And I remember sitting in that examination hall, and there were 88 other candidates for the MFD exam, and just 12 of us had cleared. All of them were sitting with their books and just going through, like I don't know how much they're going to cramp up. And I'm just sitting like this and I'm watching. I'm like, what is this? And they didn't allow phones inside that I could sit and do something. I like literally, I sat like this for 2 hours before my number was called for the exam. So it's okay. Don't be in a fear of missing out just because you see your friends or other people cramming up, going on thousands of social media groups just to make sure you don't miss out on anything. No, this is not the right way. It will just stress you out. Be focused. See, nobody knows 100% of anything, but you are expected to know 80% of all the commonly asked things. So why you want to focus on the 100% then? Why you want to stress yourself out for the rest 20%? Nobody knows that. But you be just very, very sure of the 80% that you know, and use your common sense for the 20% that you know. This is how you're supposed to live your life as well. You understand? So, anyways, let's start by solving this question. So yeah, I was just saying in the last 7 days what you're supposed to do. According to me, therapeutic guidelines, infection control, read once and solve the past papers. One paper per day, that's it. You should not be sitting more than 5 hours a day. The rest of the time, exercise, go help your parents or help your family in some work, be useful. They have been supporting you so far, and just express your gratitude to them, thank you, and that you're going to give the exam. Make sure you don't eat outside, prepare your own meals, and while eating the meal also keep on manifesting that this food is going to nourish me, this water is going to bring energy to me, and I'm going to perform really well in the exam. uh, I'm not kidding, it works, it really works. All the good vibrations, the good positive thing just attract towards yourself. Vibrations really matter. Sometimes you meet somebody and you're like, I like the vibe so much, I just feel connected with this person. And even though you may be staying with your relative for ages and ages, you're like, I don't like this person. It may not be something that he said, it's just the energy that you feel, you cannot see, you know. So start having the right energy. And anyways, to all my enroll candidates, I always tell them, manifest in the morning. All those questions in the exam would be asked, the answers of which I know, right? So do that. So yeah, after doing all this, let's just focus and solve one question right now. And definitely this similar kind of a question is going to come. ADC loves to ask questions on pregnant women. Okay, so let's start. A 26-year-old pregnant lady has come to you complaining of pain on tooth 5. She's 10 weeks pregnant. 10 weeks means what? Which semester? 1, 2, or 3? It's 1. Each semester 3 months. 3 months is 12 weeks, and this is the 10th week, the first trimester. After taking her medical and dental history, you did a clinical examination and found out the accused tooth required a root canal treatment. Your investigations are done. You know this tooth has to be treated this way. But the lady is in first trimester. Now, do you work in first trimester? The textbook recommends no. It says you have to work in the second trimester. Which trimester is safe to perform treatment? Like I mentioned, first and third is usually not recommended. It's not contraindicated, it's just not recommended. There are times when you may have to operate in first and third trimester also, but they have to be like some emergency urgent situations. Otherwise, something that can be deferred with medication, then you should defer it. So, which trimester is safe to perform treatment? Second trimester, which would be 14 to 28 weeks. Correct. 8 to 14, the 8 becomes in the first trimester, though the 14 is in the second, so it's a dicey option. 29 to 36 again falls a bit into the third trimester, so the safest one is 14 to 28. Your patient is pregnant, with statement below is correct about pregnant patient. Correct. That means so such kind of questions will always have one correct and the other wrong, because you just have to see the correct one. Unlike the other options, other questions which says which is the best. treatment. Then you have all the treatment which is correct, but you have to choose the best one. And the best treatment can keep on changing according to the scenario. It's like me saying, who's the best person in your home to ask to make say pasta? You will definitely answer it's mummy. Daddy may not be knowing, in general I'm talking about. Or if I ask you the question, who's the best person to ask money for a trip that you're going outside, then the answer would be, your father probably. So the best option in the same family will also change according to the situations. Or if I ask you, who's the best person if you want to have a party in the house, you'll be like my brother or my sister. Like you wouldn't get your parents there, right? So you have to read the question very carefully and understand the main scenario, which is the best option in this scenario. So you cannot mug up these questions. Hence, the understanding of concept. Like concept is basically knowing the members of your family, who operates how, whose weakness is what, who can listen to you, who will not listen to you in what situations. That is called as a concept. So, yeah, your patient is pregnant with statement below is correct about pregnant patient. Patient not allowed to have an X-ray in the first trimester. No, you can, of course you can. Patient can have X-rays with lead apron. Okay. Patient is not allowed to have X-rays at all. Wrong. Can have X-ray when clinically indicated. See, option B and D both are correct, but therapeutic guideline says that you can use a lead apron once you are using a maxillary occlusal film. Otherwise, you pretty much treat any patient without the lead apron. So I will go with option D because option B means for whichever X-ray you have to use a lead apron, and therapeutic guidelines doesn't mention that. But it does say that you can have X-ray when clinically indicated, be it any trimester. What is the safest painkiller at 32 weeks of pregnancy? Now, between this and the next question, a lot of candidates missed a keyword, and when I explained it to them, they were like, "Oh, we missed." But your "oh, we missed" is going to mark one answer wrong in your exam. That is why you have to be very careful in reading the question. See, I'll show you the difference. Which is the safest painkiller? They just asked about the painkiller. The safest painkiller is always paracetamol. But now, in the next question, it says she missed an appointment, she's back, you're completing RCT, blah blah. Currently, she's breastfeeding, and which NSAID is safe for her? And now the options are again kind of the same. You have naproxen, celecoxib, paracetamol, codeine, and you have the same options in the previous question as well. Now, in the previous question, the question said safest painkiller. But in the next question, it's saying which NSAID is safe for her. Yeah, I get it. NSAID is also used as a painkiller. But NSAIDs are a different classification of drugs. And in this question, many candidates again marked paracetamol and it turned out to be wrong. And they messaged me, Doctor, why is paracetamol wrong? I'm like, it's paracetamol and NSAID. And they're like, oh. And then I was like, ah. So, yeah, read the question. It's a pretty straightforward question. So, in this question, the safest painkiller, like I explained, is paracetamol. So, again, see, safest painkiller. That means all the options that would be given to you would be of painkillers. But they are asking about the safest option. You understand? So, then you choose paracetamol. This is not like single tick MCQ that one is right and four are wrong. No, all are right. And the next question is which NSAID is safe for her? And in that, again, they have mentioned all the painkillers, including paracetamol. And that's why your basic dental concept has to be clear that paracetamol is not an NSAID. Celecoxib is a selective COX-2 inhibitor, hence the answer becomes naproxen as given in therapeutic guidelines. Okay, straightforward. See, therapeutic guidelines is straightforward information giving. It just says this is safe, that is safe. The exam gives you question in a confusing format. So even though you know the answer from therapeutic guidelines, you are not expecting your question to be twisted and tricking you in this way. And that is what the exam is all about. If it was so simple, then the passing rate wouldn't have been just 24%, it would be 100%, right? So this keyword reading is the crux of your ADC exam. Again and again in all of my videos I have said this. Still, if you make a mistake, it's on you. You're performing RCT for the pregnant lady. You are laying her in a supine position. She feels faint. She's having like lack of blood supply in her brain region, so she feels like fainting. Now, what could this be? So, in pregnant patients, it is supine hypotension syndrome, basically. Preeclampsia is increase in blood pressure or hypertension exclusively just in pregnant patients. Hypoglycemia, no mention of diabetes anywhere, so I wouldn't go with that. Vasovagal syncope, not a wrong answer, but because the question mentions that she's pregnant and that you are laying her in a supine position, then the supine hypotensive syndrome is the right choice because that is the one. Vasovagal syncope can happen in anybody. The patient doesn't necessarily have to be pregnant. Like I get a vasovagal if somebody shows me a big needle to be injected to me anywhere. Like I'm terrified of it. Though I give local anesthesias daily. Like out of 10 patients book, 6 will definitely get it, some or the other procedure. But yeah, if somebody tries to give me, I'll have a vasovagal syndrome. So yeah, supine hypertension syndrome is the answer. So I hope this is clear. You will definitely 110% get a question on pregnant patients. So please, please, please read that. Okay. So best of luck for your exam, and like I mentioned, do write in the comments how your preparation is going on, what else you want from me, and I hope I can help with that. Bye bye.